Hey everyone, I'm Craig. I'm about to get jaw surgery to fix my sleep apnea. And when I was looking around on YouTube and the internet, there wasn't really that much information out there. So I figured I'd document my experience in case it helps someone else going through the same thing. Before I get into the surgery details, I want to talk a little bit about sleep apnea and using a CPAP for a moment. I think there are a lot of people that would really benefit from CPAP therapy, but there still seems to be some sort of reluctance to using it. I think that probably comes from a couple of things. First of all, when we were younger, at least people my age, our dads, our uncles, our grandfathers, etc., did not use CPAPs, and that's simply because the technology wasn't available at the time. This meant that we kind of like wrote everything off, like snoring and odd sleep patterns, etc., as hereditary and just something that happens to old men. But that doesn't need to be the case. The other thing is that breathing devices really didn't exist back then, except for huge ventilators that were for very, very sick people. And obviously the thought of having to use one of those ventilators was not particularly appealing, not appropriate either. But the CPAPs today are much smaller, quieter, and certainly nothing to be embarrassed about. My whole journey began when I heard a recording of myself not breathing for over 2 minutes and then gasping for air like a dying animal when I was finally able to breathe again. That was really the wake-up call for me that got me on CPAP therapy. Heading into the surgery coming up, I actually had a sleep study done last month, and the results showed that I was stopping breathing for up to 68 seconds at a time, with an average of 22 full cessations every hour, each one lasting about 30 seconds. So doing the math, that means that for every hour, I would stop breathing for almost 20% of the time, a full 11 minutes every hour without being able to breathe. In addition to that, there was the times that my breathing was impeded and I was struggling to breathe. And the combination of those two actually brought my AHI score up to 65.4. The AHI is an index that's the severity score for sleep apnea, where basically a score of 30 and above is considered severe, and some doctors actually refer to 60 and above as extremely severe, and I came in at 65.4. I've been using a CPAP for 9 years now, and it's definitely added years to my life, especially in light of those numbers. Fortunately, because I was involved in bodybuilding, there was no stigma attached to using a CPAP if you were a bodybuilder, because a lot of guys needed them just because they were so big. So I didn't really feel out of place or anything in terms of trying the therapy out. So I will say this clearly: if you snore, or especially if you snore badly, go get a sleep study done and see if you can get on a CPAP. I still remember the first proper night of sleep after starting therapy. The difference was absolutely remarkable. Instead of being jolted awake by an adrenaline surge as my body tried to wake itself to keep itself alive, I actually woke up to my alarm and my entire body felt sluggish and heavy. I hadn't had a sleep like that was that restful in decades, and it actually felt really strange because, I just never had that feeling of being rested. I would always bolt out of bed and be ready to start the day right away. So it was a very, very almost disconcerting feeling to having been so rested. After a few nights of this, improved sleep, it did start to become easier to wake up. So clearly I was just sort of like refilling the sleep deficit that I had accumulated over time. And my body had finally managed to get the rest that it needed. But fortunately, those days of waking up with the adrenaline rushes were over for good. So again, if you snore or stop breathing in your sleep, please get a sleep study done as soon as possible. It will change your life. Now, moving back to the surgery. My sleep apnea seems to be caused largely by genetic factors. I have a really small jaw. So small, in fact, that I was only ever born with one wisdom tooth. The small jaw creates problems because it doesn't give enough room for my tongue and all of the other soft tissue in my mouth. So when I sleep, everything inside collapses back, pulls back and collapses on my airway. I had orthodontics as a kid as well, where they pulled some adult teeth and put me in headgear to help align with the others. But that actually only made things worse. So right now, my airway is only 6 millimeters wide. To put that in perspective, that's literally the same width as the average drinking straw. So I'm breathing through a straw. The surgery I'm getting is called maxillomandibular advancement surgery, or MMA surgery, which is a pretty cool name, or double jaw surgery, which is also known as DJS. It's a pretty significant procedure, no question about that. Using it for sleep apnea is relatively new, really only gaining acceptance in the past 10 to 20 years, although it's been done for sleep apnea since the mid-1980s. Because it's not really widespread enough yet to use it for sleep apnea, and there are a lot of people that want to get the treatment done strictly for cosmetic reasons, insurance often doesn't cover it, although I understand that there are some places where you can get partial coverage depending on where you live. Here in Japan, some of the procedures can be covered, but the orthodontic work is all out of pocket, which is a very significant expense. I opted to go entirely private because trying to use national insurance had me going to a number of different hospitals, had me seeing a number of different specialists, and I happened to have the perfect window of opportunity with respect to my work schedule come up, so I opted for the private route despite the higher cost. So the way that the surgery will work for me, which may be similar to others, but obviously is unique to each case, so not necessarily the same, is they're going to cut my lower jaw and slide it forward so that the bite matches. Then they're going to cut my upper jaw, and they're going to shift the upper and lower jaw out and then rotate it counterclockwise. And this is going to expand my airway. In addition to those procedures, I'm also having a third element done called a genioplasty, and that's going to extend my chin, which will help to expand the airway even further. I'm not sure if this is going to completely cure my sleep apnea, but given that a lot of it is driven by my small jaw, hopefully it will help enough that I don't need to use a CPAP anymore. So fingers crossed on that one. As mentioned, this is going to have a pretty significant impact on my appearance as well. However, usually when you get major surgery done, your appearance takes a bit of a hit. I know this well because I have torn ACL, torn Achilles, I've torn rotator cuffs, biceps, etc., and the appearance usually always takes a hit. However, in the case of this surgery, it improves the facial balance of the patient, so most patients actually wind up looking a little better after it's done. And to the extent that there are people that actually get this exact same procedure done strictly for cosmetic reasons. I think that, as mentioned, may be one of the reasons why insurance is kind of reluctant to cover the procedure, because it's hard to differentiate whether somebody is doing it for sleep apnea or for cosmetic purposes. So the clinic that I'm getting it done at is actually a cosmetic surgery clinic, but as mentioned, my motivation is to fix my sleep apnea. But that said, if it means that I'm going to look a little better after, then that provides even more incentive to get it done. In terms of the mental perspective or the mental side of things, I know that this is going to be a major operation, but to be honest, I'm not really that worried about it. I'm more excited, I would say. I did make the mistake of watching part of a procedure being done on YouTube, and that was pretty hard to watch, so turned it off right away. I've also watched a bunch of recovery vlogs and read some articles online, so I know that while this isn't going to be easy, thinking about the benefits that are going to be coming in terms of potentially correcting my sleep apnea, and also if there is any, secondary appearance benefits, the cost certainly outweighs the price from that perspective. In addition to that, I've also been through a number of surgeries before, as I mentioned, and also done things like competition prep for bodybuilding. So I know that I can handle a pretty significant amount of discomfort with no problem. So I'm just hoping that I'm this optimistic in the first few days after the surgery, because they do look really rough, but we'll see how we go from there. I am planning to document this journey, so if there's anything that you want to see or anything that you want to know about, please let me know, leave a comment below, and I'll try to incorporate it in the videos that I make. Thanks very much for watching. Please subscribe if you're interested, and I hope this information helps someone. Next video, I'll be covering about how I'm actually preparing for the big day, and I hope to see you then.